So I'm Nishant and lead the longevity and peptide category for Valeo Health. We'll just give a few more minutes for people to join. I see a lot of people joining. So today I'm excited to welcome Dr. Anant, who's joining us early in the morning from New York. So thank you, Dr. Anant.
Thank you.
So for a quick introduction, Dr. Anant is a longevity-focused clinician, is an entrepreneur with a clinical and business background. He has a really impressive resume. He studied in Stanford University. He did his MD at Harvard Medical School. And also he went on to do his MBA from the Harvard Business School. He has a deep real-world experience with peptides therapy and how it fits into the clinical framework and how to think about it in a practical, clinical-led way. So I'll hand over the call to Dr. Anand so he can start over the presentation and speak about peptide and his experience. So we'll take the Q&A to the final at the end of the call. So during the call, please do, our team is available throughout, so you can just send any details you want in the chat. And please stay throughout the call. We have a lot of surprises for you in the end of the call, so please do stay. So Dr. Anand, over to you.
All right. Well, thank you so much, Nishant. And I actually live in Denver, which means it's just a little bit earlier as well. But it's great to meet all of you, and I'm really excited for this conversation. Peptides are becoming more and more popular. I think people that may not have had any idea what they were a few years ago are now starting to talk about them. We're seeing this come up in places that we hadn't before. It's seemingly all over social media. And so I think now is as good a time as there ever has been to have a really honest and science-based conversation about what peptides are and also how to think about them. And my hope is that by the end of our talk today, you're going to walk away with a framework that helps you understand peptides through the lens of what they actually are, which are signaling molecules, signaling agents. I'm sure you've heard on social media and Instagram these different ways to think about peptides through the lens of stacks, like the glow stack and the Wolverine stack and the muscle stack. And that's what everyone else says. That's how everyone else talks about them. I'm going to present to you a perspective that, as far as I know, no one else presents. And this, I think, is going to be the perspective that is going to endure as we continue to learn more about peptides, especially at a scientific level. And so my hope is that this will be a useful framework that helps you navigate peptides, not just today, but for the foreseeable future as the field continues to develop. So just by way of background, I'm an internal medicine trained physician by training. I've had a chance to work at some amazing places, as Nishant mentioned. And then, after I finished my residency, I was actually kind of more working on the business side. And most recently, I was a part of building up one of the first national longevity clinics here in the United States called Modern Age. And then after I left that business, I've now been in the education enablement space. So I have my own business, which is called Next Generation Medicine, where I educate clinicians and biohackers and really anyone who wants to learn more about how to navigate this new and emerging space of longevity medicine. I provide education. And so if you guys are interested, my website's nextgenerationmedicine.co. You can also follow me on LinkedIn. And then I also work with companies like Valeo and help them figure out how to make the best use of tools like peptides as part of their clinical programs. So with all that being said, let's go ahead and dive into the presentation. So I'm going to go ahead and share my screen. So that's me. And so let's first talk about where I think there are some deficiencies in how we're talking about peptides right now. And again, this is likely what you're seeing on social media where, we present things in a way that's super easy to consume. It kind of ties into what people want to hear. And as you'll quickly learn, if you haven't already in this field, what people want to hear and what they need to hear are often two very different things. And so what people want to hear are the top 10 lists and the best protocols and the best stacks and recipes and things like that. But there is not enough thinking about what actually is going on here. Like, what are these peptides actually doing within our bodies and in our cells? And so as a result, both patients and practitioners don't have like a really scientifically meaningful framework for how to use a peptide. And so people start off with these stacks, right? Like BPC plus growth hormone secretagogue, like BPC plus tesamorelin or BPC plus TB4. They start with it, and sometimes that works, but if it doesn't work, people are often left basically guessing, right? And that's because people don't really have a framework apart from these stacks. And so what we really need is a framework to organize peptides through the lens of what they actually are, which are basically signaling molecules, right? So every cell in our body speaks a language. And this language is used to carry out all the essential functions, whether it's cells dividing, cells cleaning up after themselves, cells sometimes selectively destroying themselves. There is a language to all of this, and that language is cell signaling. And at a high level, what peptides are basically messengers that carry out this signaling orchestra. So in most cases, what happens is a peptide binds to a receptor on the surface of a cell. If you imagine a cell being like a container, right? On the outside of the container, there will be a little docking spot, and our peptide will bind to that docking spot. And then once that docking happens, a whole bunch of things happen in the cell and different programs are executed. And so we have to think about things through that lens. And so one of the things you'll see as I talk about peptides more in this presentation is that there are different pathways. Think of these as programs that are activated by peptides. You'll hear about pathways like the AMPK pathway, or the mTOR pathway, or the PGC1 alpha pathway, or the NF-kappa B pathway. All of these are pathways that play major roles in executing key cell signaling programs that help cells do important things. Now, very importantly, what we also see is that when we look at diseases, whether it's obesity or cardiovascular disease or Alzheimer's, very often what we see are basically dysfunction of these pathways. We see NF-kappa B is out of balance, or AMPK is not working properly. And so this is one of the reasons why it's so important to understand things through these lenses, is because not only are peptides acting through these pathways, but these pathways are also how disease and suboptimal health unfold. And the last thing I'll say here is that one of the reasons why peptides work so well is because they speak the language of the cell, right? A BPC 157, take that for example, right? That is binding to a receptor that the cell has that can recognize BPC 157. Compare that with traditional pharmaceuticals, which again, I'm not opposed to. I think they definitely have a role. But traditional pharmaceuticals the cells do not know what to do with traditional pharmaceuticals. If you take a statin, for example, there is no statin receptor, there is no statin pathway. That molecule comes in and it just categorically blocks something. And the biological effect can be desirable. But one of the reasons why peptides work so well with so few side effects is because they speak the language of the cell, and that language is cell signaling. So super important to keep all of that in mind. And so we keep going here. The first thing I want to say, and this is probably obvious to most of you, hopefully all of you, is that before we think about using peptides in any sort of treatment program, we always have to think about the foundation. And the foundation is our lifestyle interventions, our sleep, nutrition, movement, stress regulation. I'm not going to belabor you guys on what these things are, why they're important. Hopefully you already know that. But just to emphasize that without optimizing these things first, we should not be reaching for peptides. Or at the very least, we should be thinking about optimizing these in concert with using peptides. And the reason for this, again, comes back to cell signaling, right? Peptides amplify or modulate existing signals, right? They don't create new signals, they amplify or modulate existing pathways. And so the foundation of how these pathways function is dictated by these behaviors. And so if these things are not properly balanced, it's kind of like, imagine like a volume knob on a stereo, right? Peptides are like turning that volume knob up and down, right? Or turning up the bass, the treble, whatever. But the stereo itself is broken. then it's not going to have a good result, right? So the speakers are broken. So we have to make sure we address the foundation. All right, so I have a framework that I use to think about peptides and really how to think about biology. This is the framework that I use in my course. And this is a way to think about cell biology in a kind of a simplified way. And this has to do with the different functions that cells have to carry out. And this framework has an acronym called SHIFT, S-H-I-F-T. And each of these different letters stands for a category of functions that a cell has to do. And then within each category, there are certain pathways that are important to consider. And then what we'll see is that peptides act on different pathways in these different domains. And so when I think about a peptide, I'm always asking, how is it affecting each of these different compartments? And just to kind of go through these, S is basically nutrient sensing. So how can the body sense and detect inputs, specifically nutrition, like protein, fat, amino acids, protein, and carbohydrates. Homeostatic defense is the cell's ability to clean up after itself. This is where things like free radicals and oxidative stress come into play. Inflammation is basically the cell's ability to recruit an immune response that is balanced, right? We want an immune response to clear away damaged cells and to get rid of infections, but we don't want it to be overactive. Fibrosis is basically the cell's ability to repair itself structurally. This is where things like recovering from injury come into play. And then T is timekeeping, which is basically the cell's ability to coordinate all of this on a rhythm, right? All of these different programs have to be executed on a rhythm. We have our circadian rhythm, we have a menstrual rhythm, we have probably many, many other rhythms that we're just starting to learn about. So whenever I think about a peptide, I always think about how is it affecting each of these different domains. And so, what we should be using is this new language, right? Instead of just saying BPC-157 is a healing peptide, or it's promotes blood flow, right? Like let's start to think about it through the lens of this framework, right? Where it modulates nitric oxide and angiogenesis, which is part of the homeostasis domain. It also influences injury signal interpretation from the S domain. It helps to reduce inflammatory spillover from the I domain. So this is one of the reasons why it's such a great peptide. It's a versatile peptide, because it affects so many different domains, right? And so here we have mechanistic clarity. We have awareness of cross-domain effects. We have built-in monitoring logic. So we know what to measure in terms of biomarkers. And if things don't work, we can think like, okay, which of these domains may not be properly modulated, right? And how can we maybe bring in something else that can push that, right? So we have to have a working model of what's going on in our heads as we use peptides. So these are just some examples of peptides. I'm not going to read these all off. You may have heard of some of these. GLP-1s certainly are very popular. Then we have other peptides that act on different pathways and have a whole range of different desirable effects in the body and from a physiological perspective. And so nutrient sensing, right? This is the first category, right? This, most concretely, we measure through the lens of glycemic response, right? There are hopefully going to be other ways to measure this, but by looking at, for example, a CGM tracing, we can get a sense as to how effective any peptide that we're using on the signaling domain is actually working. And so hopefully you guys have heard of CGMs, but they can be, tremendously useful tools in concert with other blood measurements like fasting insulin, triglycerides, and that sort of thing. But, if we're using a peptide that's going to be acting on this domain, like a GLP-1, we should be in some way monitoring this axis, right? So we should be looking at a CGM tracing or something similar to see how things are going. And of course, symptoms matter too, right? Subjective, and this is what most people tend to use, is just a subjective experience. But your appetite, for example, is gonna give you a key insight there. In the H domain, we have our body's ability to repair itself, the homeostatic defense pathway system. Here we have several different pathways. I've alluded to some of these. The antioxidant response pathway, the NRF2, that turns out to be super important. Proteostasis, which is basically the body's ability to clean up damaged proteins, is also important. This is tied into autophagy, which you guys may have heard of, cells' ability to clean up after itself. And all of these things, as you can imagine, break down with age and certainly break down in the context of disease. So there's a range of peptides that support this, everything from TA1 to PPC to TB4, a lot of things that just generally help the cells be more resilient and clean up after themselves, activate these homeostasis programs. And so here, in terms of what we measure, here, we have some blood tests that we can use. Like, these are not listed here, but measuring lipid peroxides or DNA damage like 8-OHDG can give us a measure of how much oxidative load there is. And then, of course, we can also measure things like recovery time and more subjective measures as well to see how effective we are being at addressing this domain. So I is our inflammation and immune tone. Here, there are several key pathways that are all involved with activating the immune system. I think NF-kappa B is probably the one I would call out. That's this NLRP3 inflammasome. This is an important, NF-kappa B is implicated in this. There's JAK-STAT, there's several others. And why this is important is twofold. Number one is that we know that as we get older, there is this chronic low-grade inflammation called inflammaging that just gets activated. And this results in kind of like a smoldering fire happening in our bodies. And so that's why we have to address this. And when we have disease or dysfunction, all this inflammation gets turned up quite a bit. And one of the more interesting observations clinically over the last couple of years has been that people who have metabolic syndrome or obesity actually very often have very high levels of inflammation. And it's likely that the inflammation is an input that's making what seems to be a metabolic situation even worse. And so GLP-1s, one of the reasons why they seem to work so well is because they act on this pathway as well as the sensing pathways that we talked about before. And so there are several different peptides that work here. I would add GLP-1s here. I think it's worth it. GLP-1s are fantastic because they work in so many of these different pathways. But TA1 works here. BPC also works here. We talked about that mechanism briefly. LL37 is a antimicrobial peptide, and it's also immunomodulatory, and it also plays on these pathways. And so that is another tool in our toolkit. And so here, in terms of how we can measure it, CRP is a very readily accessible biomarker that can help us measure inflammation. And then, of course, measuring subjective symptom scores if people have something like rheumatoid arthritis, measuring to see if that is improving in terms of joint pain, things like that. And also just better sleep quality, things like that. And so F is, one of the more interesting components here, because I feel like a lot of our biomarkers, a lot of our testing, I feel like we implicitly do test for the first four, or I guess, the first three. But fibrosis often gets overlooked. And this is partly because we don't have a lot of great ways to measure this pathway. I think that will change soon, but basically fibrosis is basically the cell's ability to remodel itself structurally, right? So there is a supporting scaffolding, like imagine scaffolding for a building. Our cells sit within scaffolding. And this is comprised of collagen and hyaluronic acid and other compounds. And there are various pathways that are responsible for basically repairing this and maintaining it. These include pathways like TGF-beta. You'll hear that come up a lot. Interestingly, TGF-beta seems to be really dysregulated after COVID. And it seems like this might be one of the reasons why people who have long COVID have so many issues related to their vasculature, because this pathway is completely out of balance. And so anyway, this is an important thing to consider. And we don't have ways to measure these pathways for the most part. I think you can get a TGF-beta from some labs, but in a lot of cases, we can't really measure things. What we can observe is just kind of tissue quality and consequences of tissue quality breaking down, like arterial stiffening, things like that. The idea is that this one is actually connected to a lot of the other pathways, right? Like especially the domain, right? Where if we don't have enough repair, right? If we don't have a good ability to maintain homeostasis, we gradually drift towards fibrosis, right? You can also think of fibrosis as kind of being like an end state of dysfunction, right? Like if dysfunction is allowed to persist for long enough, it will eventually wind up with fibrosis, where you basically just have tons of just dysfunctional tissue. Think of it as like a forest that burns down, right? You just have parched earth that is not, not viable. That's kind of what happens with fibrosis. And so this becomes really relevant, practically speaking, for musculoskeletal injuries. If we don't allow those to heal, those tendons, those ligaments become basically like scorched earth, right? And they don't really function anymore. And so we have to think about these pathways here. And we have a range of different peptides to address that, such as TB4 and BPC. And then finally, our timekeeping domain really pertains to things like our circadian clock, and other rhythms. And so much of our cells function, all these programs we talked about before, are under the control of a circadian rhythm. And so if we don't have that rhythm properly set, then things are not going to function. Even if the pathways themselves are functioning well, if the timing is not right, things will not function well. And so this is why you see so much dysfunction associated with poor sleep architecture and poor sleep. And so there are several different peptides here. DSIP is a delta sleep inducing peptide that helps promote deep sleep, and as a result kind of has a positive effect on the circadian rhythm. Epitalon is another one that seems to work on the circadian rhythm. It also might work on telomerase, which would be more of the H domain. And growth hormone secretagogues also importantly help us with sleep. That's a very common positive effect of growth hormone secretagogues is feeling like sleep quality improves dramatically. And so, there's several different peptides here. And then, I think like there are many different ways to measure this. I hope we find ways to measure other rhythms that we have, but right now, for the most part, what we're doing is we're measuring our sleep quality. And so we have a whole different range of metrics here that are available to you via, commercial wearables like Oura rings and Whoop bands and things like that, HRV, sleep onset latency, deep sleep percentage, REM sleep percentage, that sort of thing. So very important to also keep in mind, we do have a range of tools in the toolkit to address. So now, as we think about this framework, we can start to think about how we can rationally put together protocols, right, that use this framework, right? So very often, I will start with optimizing those timekeeping and nutrient sensing domains, just because they're so essential and so foundational. And we have to make sure that when we're addressing homeostasis, that we have the right inputs to that, right? So we have to make sure that we are doing exercise and training and things like that to make sure that we don't have this H to F drift, right? We have to make sure that we're balancing, improving homeostasis with avoiding fibrosis. And then inflammation is often secondary, right? So very rarely do I just address inflammation alone, right? Because very often it is the downstream consequence of poor nutrient sensing or poor homeostasis. As a result, if that becomes dysfunctional, then the immune system becomes dysfunctional. So very often I will often think of this as a secondary one. And always important across the board to address the defined success metrics before you start. So I think it's also very important to be very intellectually honest about peptides. Like there is a lot that we don't know. And if you're going to be using these for yourself or for your patients, you have to be aware for yourself and honest with your patients that there's a lot that we don't know. We do not have long-term safety data. The mechanism of action sometimes is incomplete or speculative. Individual response variability can be high and is poorly understood. With all that being said, there is this really large amount of clinical experience that's been built up with these over the last 10 plus years that gives a lot of clinicians confidence in using them. But Peptides are hypotheses. They're not established therapies. Monitoring is essential. They are not a substitute for the foundational basics. And it's important to emphasize that it worked for someone else is not a mechanism. That doesn't mean it worked for you. A lot of people I know intrinsically base what they do off what works for other people. And that is like, I'm not saying it's not a valuable proxy, but like, I think that I would just challenge us to just have more thoughtfulness about how we think about this. And so I think, look, in every jurisdiction, peptides have different kind of degrees of controversy. Here in the United States, where, a lot of these peptides are not, at least right now, we can't legally use them from a compounding pharmacy. So we actually don't have as many tools available to us at the moment. I know that in this Middle East jurisdiction, my sense is that it is a little bit more open. But I think it's also important for anyone using this to be keenly aware of what their jurisdiction permits. The last thing you want to do is wind up on the wrong side of the law or of some regulatory body. So make sure you're crystal clear on what you can and can't do. Make sure you're comfortable with the fact that there's a lot of unknown here, and make sure your patients are as well. And make sure you have honest conversations about them. You do not want to be hyping people up and getting people to be, feeling like this is the next best thing and all this stuff. I mean, they can be powerful tools, but there's a lot that we don't know. They have to be paired with the right foundational interventions, and they have to be monitored closely. And you have to be comfortable with the unknown. You have to be comfortable with the unknown, both you and your patient. Cannot emphasize that enough. Proper informed consent is so important when it comes to these sorts of things, as compared to conventional approved pharmaceuticals. Here's just a list. I'm not going to. We should really put in an F here. Otherwise, this looks like not a great word. Anyway, you can just see here. These slides will be available to you after the presentation. But you can just see here a summary of how these different peptides work on different domains. And again, this is just the point here, just to give you a framework to help you navigate what all these things are, right? So that you don't just feel like you're just regurgitating marketing speak, which is how a lot of people think about peptides right now. And so like I mentioned, I do education in longevity medicine. We cover peptides in depth. We have a whole, probably the most comprehensive curriculum out there related to longevity medicine. We cover not just peptides, but supplementation, precision lifestyle interventions, advanced therapies like, stem cells, exosomes. We cover AI. We cover a lot of stuff here. So if you guys are interested, here's my website, nextgenerationmedicine.co. If you put in this landing page here, .co/LP/clinical academy, you'll get access to a special offer. And I would love to see some of you guys in there. And you don't have to be a clinician. You can be a biohacker. You can be an entrepreneur looking to build a business. I think if we're all more thoughtful and measured, and we have frameworks and we're consistent, I think we can usher in a really bright future for this new era of medicine. I think where I get concerned is if we just let the marketing get ahead of the science and we start putting things out there without really understanding what's going on. That's where I think we set ourselves up for less of a bright future. Let's just put it that way. And so just to reemphasize, peptides are adjunctive, not foundational. We talked about those non-negotiables. We talked about using the domains to help you target what you do. And I think understand that this is iterative. Like seldom do we find a peptide stack that just, works forever or works on the first try. You're going to have to evolve what you do because your life changes, your physiology changes, which is why I think it's so important to work with a provider. I think it's essential. Like I know it's possible in some places to do this on your own. And some people are successful doing that, but I would really, really emphasize working with a provider. I know Valeo has, some really fantastic providers that can do this with you. And so I would just really emphasize that and, take this very seriously because, it's your health, right? So, okay. So this summary of biomarkers to measure on that point. And this is a shift model as an operating system. Again, just emphasizing the importance of having a framework. So with that being said, I'm going to wrap up here. If you guys want to get started with Valeo, here is a QR code that you can scan to do a free consultation. to see if peptides can fit into your own health program. With that, I really appreciate you all listening, and I'm happy to open it up for questions.
Sure. Thank you, Dr. Anand. It's been great having you as a Chief Medical Officer, and the guidance you provide for us is really invaluable. So with all the doctors and clinicians on board, so we don't do just marketing. So it's just not peptide, just a tool, and the clinicians and your knowledge and your experience with help us building up the peptide protocol, doctor guided peptide protocol. So yeah, we'll open up for Q&A. So if anyone wants to directly ask any questions, please raise your hands, and the team will call your name out. Yeah, Dr. Zainab, please go ahead.
Thank you, doctor, for your output in terms of peptide, because it's very new to all of us, especially here in Dubai. So recently, I've received too many questions from the patient regarding, for example, this type of peptide that help us to lose the fat mass in our body. So, the peptide, it will be as a cycle, like 4 weeks, 8 weeks, or sometimes 12 weeks. So they keep asking me, like, I will have again the same muscle mass when I stop taking peptide. So I always answer, if you didn't stick with a healthy lifestyle and healthy diet and exercising, maybe you will gain weight, because this, it happens for GLP-1. When we stop GLP-1, some patients gain weight and lose muscle, right?
Yep.
So double check regarding this point, because majority of patients ask the same question in terms of this, especially for the type of peptides that help in losing fat mass and gaining lean muscle mass.
Yeah, it's a great question. And I think your answer and your thinking is spot on. I think that what these can do is help you augment what you're doing with your lifestyle, or help you be better about some of these lifestyle behaviors, right? So for example, a growth hormone secretagogue can help you sleep better, or it can help you have more energy to exercise, right? But you still have to do those things, right? If you take this peptide and if you don't do those things, then at some point the peptide will not have a good effect. So really, you need to frame these things as augmentation agents. They're like, they can help start a fire, but you have to nurture, you have to kind of keep the fire going by giving it wood, right? So I think that's the right framing. And then in terms of cycling, I think this gets into like the specifics around dosing. I intentionally did not talk about dosing and all this stuff, because I don't think I think that sort of thing is the conversation you should have with your doctor. But yes, very often, we will run these peptides in cycles, because for several reasons, one of them being just the physiology of peptides, right? So they bind to receptors. And so if you have your receptors getting constantly exposed to this peptide, eventually the cells lose sensitivity to it. And so to reset the sensitivity of the receptors, you will need to take the peptide off. And I would also just say, like, once you've achieved the desired physiological effect, you should see if you can withdraw the peptide, right? And succeed without it. Now, there are some people who are on certain peptides on an ongoing basis, GLP-1 being a very good example. And I don't think there's anything wrong with that. I think as long as you're working with somebody who is thinking about what they're using for you thoughtfully, they're measuring, they have, working hypotheses about what's going on, I think, all that can be fine. But you just have to know what you're doing, and there has to be a framework through which you're doing all of this.
Dr. Anand, there's one question. Can you read the question in the chat?
When taking peptides for anti-inflammation like BPC, can I stop abruptly, or should it be titrated out? That's a good question. I don't think that there's like a right or wrong answer. I think it would really depend on the situation and how what we were treating and that sort of thing. I don't think there's a harm in trying either approach. I think just having like a thoughtful framework to measure what's going on as you implement that, I think, is the more important thing. And so just, I would kind of defer to your provider. I think I've heard of both approaches being taken, but I don't think that there's a concrete right or wrong here. I have collagen peptides for vital proteins. This is going to give similar benefits. That's a good question. So like like a few months ago, I would have said, yeah, you know, collagen peptides don't really seem to do, they're more just structure, just more like building blocks. They don't really seem to do anything from a signaling perspective. But I actually do think collagen peptides do have some signaling influence. Now, I don't think you're going to see as profound effects from them as you would from other peptides, just because I don't think the pathways that they work on touch on some of these key cellular programs like GLP-1s, but I do think there's some signaling benefit you get from that. But I would say that it's not going to be as noticeable or pronounced. Okay, peptide bioregulators. So bioregulators we didn't cover, but those are interesting. So those actually work through different mechanisms. So bioregulators work at the epigenetic level. So they don't bind to receptors on the cell surface. The idea is that these are things that bind to DNA, or they affect how DNA is exposed or structured, and these affect gene expression more directly. And so the effect of bioregulators can be more subtle. It can also be more long-term. And so I generally think about bioregulators as being things that we use to consolidate an effect or to kind of maintain something. I will say I haven't used them a ton. We don't have a lot of research on them or as much clinical experience on them, but you know, when I have used them, it's kind of to consolidate something that I'm doing with an injectable peptide.
And doctor, so thanks for your time and expertise. It may have been my question on the bioregulators. What I wanted to ask was, do you have any opinion or experience on like the bioavailability of pill versus injectable on short chains?
I see. Yeah. I would say that injectable peptides are always going to be more bioavailable. And I think, again, like I know there are some groups out there that have created new delivery systems for oral peptides that have better bioavailability, and there's, you know, transdermal and buccal absorption systems that have come out. I'm not saying that those things don't work. I just don't have as much experience with them. I don't think we cumulatively have as much experience with them. And I think for the most part, whereas with injectables we do, and I think, like, you know, for my own patients, I rarely see a reason not to just use the injectable, right? Because most people can figure out how to do the injections and all of that. So I guess, like, to answer your question, I just haven't found the reason to go there. But I would say that we don't have as much data, we don't have as much knowledge about how the bioavailability actually plays out.
Okay, thank you. And have you had any experience with like a prostate bioregulator or something that can assist with something like BPH specifically?
Yeah, I mean, I know that there are a couple of bioregulators that people have talked about for that. I personally have not had any experience with them, but I know that I'm trying to think what that one is. I think it's Libidon or something like that.
That's right. Yeah.
Yeah. And I just haven't had as much experience with it. Yeah, I think that's the best that I can tell you. Like, I think the challenge with the bioregulators is, again, it's harder to have also a mental model around them in the way that we have a mental model for peptides, because we don't have these signaling networks that we can map things to. Like, they work somehow theoretically at the epigenetic level. Like, we don't have a way to our map of the epigenome is much less developed than our map of kind of cell signaling. And so it's a little bit harder also for me to conceptualize how to use those. I kind of find myself still at the level of the marketing, right? Where it's like, oh, this is the prostate one, you know, and it's like, I need, for me, I want more than that. I need more than that, than just being able to say, oh, this is the one that works on the prostate.
Mm-hmm.
And then I don't know how, like, it's just, there isn't as much mechanistic data about it. So that's something else I struggle with. That isn't to say that it doesn't work. I think for some people, they definitely have had some benefits, but yeah.
Sure. Thank you so much.
Thank you. Suki, you can go ahead.
I've just I've just asked mine. Thank you.
Okay, sorry. Thank you.
And Jamie just added some good perspective. Good question. Oral. Yes, I was going to say the exception would be if we use oral BPC, or usually it's oral BPC to work specifically in the case on the gut. In that case, we're acting locally, and so that is definitely a case of where the oral is more favorable. So yes, absolutely. Tesamorel and its effectiveness definitely can work. It is probably the most potent of all the growth hormone secretagogues. It can be very helpful, again, on top of a good lifestyle foundation at helping promote good deep sleep, good muscle recovery. I mean, you'll find that tesamorelin and growth hormone secretagogues are very commonly a part of a conventional kind of quote-unquote anti-aging protocol, just because the growth hormone secretagogues do so much. They hit on so many of those different pathways and compartments. So yeah, but they do need to be cycled, you need to be monitored, but those can be very, very beneficial, and they are kind of mainstays for many practitioners. In case of a negative result after use of BPC, could this be undone? So by that, I'm assuming you mean that you have some negative side effects when you use BPC. Can you reverse those effects? Again, it would depend on what's going on, but I would say generally yes. I can't say I've heard of any cases of kind of some kind of lasting negative effects coming from BPC. So I would say the answer to that is yes. But caveat that, again, these are still relatively, gray area agents. We don't have a ton of data. Yeah, extreme bloat. Yeah, I can't say I've seen that before. Again, like if you ever have a patient who experiences anything like this, the first thing you want to do is withdraw it and see what happens. Again, it's also possible that, like, depending on what's going on with the patient, there could be other things going on that are affecting what they do or what happens to them. Is IGF-1 LR3 safe option? Yeah, I mean, it's definitely something that can work, right? I would always probably preferentially start with the growth hormone secretagogues before I reach for one of those for most people. Again, just because that's an FDA-approved drug, like we have more data, we have more experience with tesamorelin than we do with IGF-1 LR3, right? So that's what I would do on that one. Okay.
He has raised his hand again, so please go ahead.
Sure, thank you. I wanted to get your thoughts or opinions on what, if there are any risks for like addiction, habitual addiction, or any risks in that sense for people using some of these.
Not from the peptides themselves. I think that where you can run into some, and this is just true of any kind of agent, not specific to peptides, but you want to make sure that people are using these with the sense that they are augmenting what they're already doing, right? You don't want people to psychologically feel like they are dependent on these things. And again, that dependence is psychological. It's not being driven by the peptide, but in the same way that, I don't know, this can apply to anything, right? Like you get used to like driving a certain car or like wearing a certain pair of shoes or something, and you start to feel like, oh, I need this thing to like perform or to do what I need to do, when in fact it's just that you psychologically convinced yourself of that fact. I think the same can be true here, and so it's important. That's why it's so important to be doing this in concert with, and ideally on top of, a really strong lifestyle foundation, because that comes with the person usually having a sense of empowerment and them understanding that these are tools to augment what they're already doing, not to replace it or to be the sole driver of it.
Any more questions?
Is there any synergies from different peptides such as CJC, IPA, and AOD? I think, again, this is where I think it just really depends, right? CJC, pamorelin very commonly is used together. AOD, yeah, I think that it just really depends on the situation. And then please spell out the peptide FDA test to take.
Yeah, because I just didn't hear the alternative version you mentioned to the IGF version that you mentioned that was safe. I just missed the version that you mentioned. When I asked about the IGF, if it was safe to take, you mentioned to another peptide to take.
Oh, tesamorelin.
Yeah.
Yeah, sorry. Yeah, yeah.
Tesamorelin. Okay.
Tesamorelin or sermorelin. Those are the two FDA approved ones.
Tesamorelin. Okay. I thought I heard mono something. That's why I was like, maybe I didn't
Oh,
hear
yeah,
it right. Okay. Thank you.
All right, this one looks like a question for you from Sravanti.
Yes, Shravanti. So we offer pharma-grade peptides. So all our peptides are sourced here from UAE, from MOH and ED, Emirates Drug Authority, licensed compounding pharmacy. So that's where we get our peptides from. So that's why we require a doctor consultation first. Then after that, there's a prescription. And UAE peptides. Oh yeah. So I don't want to comment on the company, but then we us as pharma grade peptides. It's a doctor guided therapy towards the complete therapy is doctor guided. So we always will be giving hand holding, and for the stacks we have blood testing included. Hope that answers your question.
And Doctor, I was going to ask, have you any awareness of side effects on retatrutide, maybe related to increased dosage? And also, anything, do you have any knowledge on this GLP-4 I've read about called bioglutide, NA931?
Yeah, so I think like NA931 is an investigational compound, and I think like, so what you're pointing at are basically research chemical companies that are, and this whole thing is kind of this very strange shell game that's being played where, and I think like people have generally good intentions, but I think it's just, so basically what's happening there is there are companies that are taking compounds that are investigational, like NA931, and even retatrutide. Retatrutide is not an approved drug yet. It's technically still investigational. Obviously, it's way more mature than NA931. And what they do is, they say they're selling what are called research chemicals, which are designed to do research in like labs, right? But in reality, what they're doing is they're selling peptides that they want people to use for themselves. And so it's kind of like this wink, wink, nod, nod, where on the site, if you ever go to those, they say, hey, you understand that you are doing this for research purposes and blah, blah, blah. But in reality, what people are doing is they're buying these peptides and they're just injecting them into themselves. Now, the issue is that there are lots of companies that are doing this. There is no sense of regulation or quality control usually. The legal foundation which they're doing it is very dubious. And in fact, here in the US, I think a lot of these research chemical companies are going to get shut down because they're basically violating patent and just, taking things that shouldn't. Yeah, it's just, I personally don't like to play there. I mean, I think if you can work with a compounding pharmacy, that's going to be your best option. And I think, Valeo only works with compounding pharmacies. I think that's the right way to go. You also have to think about the fact that like with research chemicals, like there's a lot of like, and it's not impossible, but like a person has to like reconstitute it themselves. They have to like measure things, and it's not impossible. There's a lot of room for error and for contamination and things like that to happen. And so I use caution, right? I mean, I think what you choose to do for yourself can be different. What you choose to do for your patients, I think that's possible. But like, I just think that I would just kind of personally stay away from all of that.
Sure. Thank you.
Thank you. We'll just take last two questions. Jamie, you have a question.
Mine's a bit open-ended, but I just wanted to say, like, where is that line crossed between, so say, for example, someone gets their blood work done, they've got a lot of like IBS symptoms, overgrowth, digestive damage, no idea on like food quality, all that stuff. And then you start looking into it, look into their like more holistic approach to supplements. But where is that line between that person's got chronic gut damage, so they might need like curcumin phytosome, some berberine support, zinc carnosine versus BPC and like KPV, and there's that line between where's that? It's quite a shady line where like some people just go straight down the battle of running to peptides, where like you just said there, the foundations. But this person doesn't even know how to like go on a diet that's not triggering their IBS symptoms every day. So it's like, where is that line between running to peptides or actually teaching them first?
It's a It's a good question. And I think there is no right answer. And let me just give you like two different ways that you can do this, right? The first approach would be to say, hey, we really need to get to the bottom of what's happening. Let's just take that specific example, right? So like we need to do an elimination diet first to make sure that we understand what foods are triggering what's going on, right? Like I think that's reasonable, right? Like I think it's a reasonable, viable approach. It adheres to the lifestyle first kind of principle that I mentioned before. I think it can also be true that people, when they're feeling so physiologically down, it can be very hard for them to feel like they can do anything right. And so what you're doing to that person is also telling them, hey, you feel really crappy, and I need you to do this very specific thing. It's going to be hard. You need to do this. And oh, by the way, you need to do these other things. You need to like exercise and sleep well. And it can just feel like overwhelming. And that's why a lot of people fail, right? And so I can also say that it is reasonable just to use a peptide or to use a hormone to kind of give people a nudge and a boost and get their physiology moving in a different direction, quickly. And now that is just a nudge, right? Like it's not going to be something that sustains them forever, but it can be a helpful nudge that helps them go in the right direction, and that can then help them, implement some of these things or get to the bottom, or just kind of get the flywheel spinning in the right direction. So a lot of this does at the very end of it become an art, right? It really does become an art where I think if you know what the tools are available to you, you can kind of read the situation and figure out like, okay, does this person just need a nudge that can help them go in the right direction? Or is there, more foundational work that needs to be done? But I think both are viable. And I think it's a very good question. And I think you should ask yourself that question for every patient. And you might find that there's a different answer for each patient.
Yeah, like to give a random example here, if you don't mind, like, for example, it's very common someone has like reflux or things like that. And then your head's like, well, do I go down DGL, zinc carnosine, or an aloe vera and things like that, or which normally works quite well, or does that person need BPC for that more intensive repair? And it's, from my experience, it's very much like you'd love you can do both, but that's like a £400 protocol straight off the bat. And it's like, so my head's like, I'd rather do the zinc carnosine, the DGL powders, teach them about foods, and then more often than they don't need it. But at the same time, you want them to get their results and see their symptoms ease as quick as possible. That's what I'm trying to say. Same with like antifungal protocols. 1 minute Allison's great, but then KPV can be really good. And it's like, where do you put the line, And it's like, there's no one seems to have that answer, which one's better. But my biggest thing is, what can that person afford? Because Allison would be cheaper than KPV would. But at the same time, it's not always the case. That's why I wanted to ask that, because no one ever really likes to answer that question. So it's just nice to ask.
Yeah, no, I think it's a great point. And I think that, for some people, cost will be a really important factor, in which case I think the approach you described is the right one. And then for others, it'll be a different set of considerations. So I think like, look, these are all things that are pulling levers in our cellular networks, and there are many different levers to pull. There's not one right path to success here. So I think that's why I think it's important to have some kind of a framework for what's going on, because it helps you realize that, hey, there are multiple levers to pull here. And depending on what's going on, one lever might be better than another.
No, thank you. I appreciate it.
All right.
Thank you.
All right. Take care, guys.
Yeah. So just Zainab, so we're gonna end the call. You can maybe text, put it in the chat, and we'll send you the answer. Right.
Thank you so much. Sorry. Thank you.
Yeah, thank you. Thank you everyone for joining us today. And thank you, Dr. Anant, for being our Chief Medical Officer and all the education. And thank you rest of the people for joining. So if you're interested in learning more about peptides therapy and exploring suitable for you, please use the QR link. So we are giving a free doctor consultation, so you can speak with the doctor and understand more about your requirements. And we will be hosting more clinic seminars, webinars like this, so you can follow our Instagram pages or social media, so you'll get to watch, see more webinars. And Dr. Anant might be coming to Dubai next couple of months, so we'll let you guys know. We can do a live event. So thank you guys again. And Dr. Zainab, please, you can put it in the chat, and I'll get back to you with your answer.
All right.
Thank you, Dr. Anant. Yeah, thank you.